كويس. اوكي. فافترض انه
هناك والله حدا يتأكد على التيم. لا بطارق ما تشي.
لا الأسئلة والله مو صعبة، وحتى سألتيني هذا الجدول اللي لا مش الأشياء يعني هو اوريدي موجودة بالمحاضرة بالضبط، يعني شو البروبلم شو الحل مالتها، ويمكن لك ما حكيت أنا يعني أنتوا لا يهمكم عن جد. كونوا على ثقة، الأستاذ دائما مع الطالب لما يشوف الطالب تمام، ودائما thank you very much. دائما نعطيكم أسئلة هي مو سهلة، لا بس أنتوا تشوفوها سهلة لأنكم شطار، لأنكم كويسين، لأنكم أحبابنا عارفين. فأبدا الدنيا ما في شيء سهل، ما في شيء صعب. تمام. أنا I am sorry أنه جيت ليت اليوم عليكم. كيف التيري اللي يا Okay. You remember we started with the pneumoconiosis, and as I told you today, the lecture is a little bit longer. I will try to make it, okay? So fast. So today we are going to discuss two pneumoconiosis, okay? That's silicosis and asbestosis. Silicosis and asbestosis. Okay. تلاقي لكم النمبر of the slides كلها صور. تمام. Okay. Actually, silicosis exists in two forms. We have either crystalline, or they call it free silica, crystalline silica, crystalline, or amorphous. So crystalline or free silica, it doesn't combine with the another substances, with the other material. There is not combined. And it is the causes of silicosis. While the amorphous, it is relatively non-toxic to the lung, relatively less. So it's combined with the other. So silicosis refers to the spectrum of pulmonary disease that by inhalation of free silica or crystalline silica. It doesn't matter. Sorry, my voice is okay. So silicosis is a major health problem among the workers. It's a major causes of permanent disability and mortalities. You remember we divided into major or minor, so this is one of the major. It's a major that causes disability as well as mortality among the worker. Of course, as you know, it is developed as repeat exposure and for a long time exposure to the silica. It is free silica. Exposure to free silica, as we said, crystalline or free silica. Of course, by inhalation of the dust containing free silica, نفس التعبير بس repeated enough. As you know, of course, it's inorganic and insoluble, so it causes irritation. Irritation is a lot. When there is irritation, there is fibrosis. When there is fibrosis, there's so irritation and inflammation of the lung tissue, so scar formation and fibrosis, it will occur. Then gradually it will take all over the lung. The fibrosis consists through the lung continue to occur even when we remove the patient or when we stop the exposure. It means it's already happened. The incidence of the silica, of course, depends upon so many factors. You know it very well, I am sure. It depends upon the chemical composition, just now we said, crystalline or amorphous. This is what, and the size of the particle. Definitely from the beginning we said that occupational disease depends on the size of the particle, of the dust, I mean, definitely. Duration of exposure, definitely it is a factor, and individual susceptibility. Of course, the higher the concentration, the greater the hazard. This is well-known fact. We say size of the particle. The most dangerous particle in silica that affect the lung is the size between 0.5 and 3 microns. Yes, it go deep. That's why it is very serious. You remember we said maybe less than 1 in the previous lecture. So here it is 0.5 to 3 micron. And it's not the most dangerous because it is go to interior of the lung easily. Of course, we say the duration. Of course, the longer the duration, the greater the risk, definitely not. Okay, it's found that in incubation or latent period, we say it is ranging between few months, we will see, and more, maybe more than 20 years. So this very long range. There is a cases of silicosis that will occur within a few months. We will see it. Okay, we will see it in coming. So the particle is ingested by a phagocyte, and you know it. We say the pathogen is across the lymph channel. Okay, and block the lymph channel. This is the pathogen location of the nucleus. So pathologically, silicosis is characterized by definitely fibrosis. Okay, initiated by silicic acid, leading to this is very important. We can differentiate it from differentiate between silicosis or silica and asbestos. Please keep in your mind. Fibrosis, we said, initiated by silic acid, leading to the dense nodular fibrosis. It causes a nodular accumulated as a nodular fibrosis. The size of this nodule is 3 to 4 millimeters. It is usually in the upper zone of the lung, while in asbestosis is so this is very, very important differentiated between, although there is another differentiation, we will see it later. So it is nodular and in the upper part or in the upper part, in the upper zone of the lung. Okay, this is very important. Of course, after fibrosis, there is emphysema and then right heart failure. Pulmonary TB will be occur. There is more liability for TB to occur among those persons. Okay, of course, the severity, the occurrence, as well as the severity of the asbestosis, silicosis, depend on 2 factors, 2 areas, on the host factor, and on the environmental factor. Okay, so dust factor, concentration, okay, as well as the duration of exposure, definitely. While on the host factor, genetic factor, there is a genetic factor. One person liable, the other is not. Okay, cigarette smoking decrease the possibility of silicosis and the presence of other pulmonary disease like TB also increase the liability. So it is depend on 2 areas, dust factor as well as or the environmental factor and the host factor that affect the occurrence as well as the severity of the disease. Now, what are the occupation or who are at a risk of exposure in the silicosis? These are maybe tunnel occurring. That's why I put it in Arabic so you can. Okay. Stand blasting and ceramic. A lot of ceramic brick making and all these. Okay. The silicon pencil. Okay. So you can see all these are the factory in which the workers were exposed to silica. Okay. Just now we said it depends on the concentration and duration, the severity. So silica can be divided or classified into 3 groups or 3 categories. We have classic silicosis, we have accelerated silicosis, and we have acute. Regarding the classic and accelerated, it is also divided into 2, simple and complex. Simple and complicated, it will change into what do we call it? Progressive massive fibrosis, PMP. Progressive massive fibrosis. Simply both, as I mentioned, classic as well as the accelerated, while the acute is, as we will see. This is, look, sand plastic and gray. Now coming to the, look, this is the pencil. Don't forget. Okay, classic silicosis or chronic from its name, chronic silicosis, it means it needs long time. So how it occurs? It is the most common result from long-term exposure. ممكن نسكت؟ Okay. Exposure 10 to 20 years or even more exposure to this. But this exposure, it is in low concentration, less than 30% in the environment. So exposure with the low concentration containing less than 30% and result from low to moderate exposure to the dust containing less than 30%. But it may be occurred in shorter time, depends on the susceptibility, definitely. Of course, as any other pneumoconiosis, in early case, the sign and symptoms in the early case, there is cough and expectoration. But there is no dyspnea. Okay? If there is dyspnea at the early stage, it means not due to the silicosis. It means it's related to another factor, not due to silicosis. By time, dyspnea appear later on. Okay? And when later on, it will be related to silica. This is a simple silicosis. Okay? And this, we say the simple silicosis, it will mostly liable to develop into complicated, or we call it the so by X-ray, okay, what you can see? Small round opacity. We say not you, round, not you. So it's small round opacity, 1 to 10 millimeter. Okay, it's commonly in the upper zone. In the upper zone of the lung. They call it snowstorm appearance. So this is snowstorm appearance. It's at the horn. It's the landmark of the silicosis. Then hilar lymph node will be enlarged definitely because it's the pathway through the pathway of the lymph tunnel. Enlarged, and not only enlarged, but there it will be calcified. The calcification will be circumference calcification. In this calcified form, they call it eggshell. Eggshell appearance. Eggshell appearance, it's appear, but it's not only for in the silicosis. There is so many other disease, sarcoidosis, sclerodermia. There is eggshell, but the differentiation is the appearance of snowstorm or the nodule opacity. Different. This is the diagnostic. Then, of course, this opacity will be enlarged with the time, definitely. It will affect all the lung. Then it will combine as a bubble. The lung will be as a bubble, and what they call it appears as a bullet. The upper zone will lose its content. Okay, so there is fibrosis definitely, and there is a area of air, and there is a basal emphysema will occur. I will go very fast. This is the lung. Pathogenesis, pathology and pathogenesis lung, of course, it will be firm and dark, little bit blacker than the normal. What do you call? Lymph nodule, there is enlargement, peribronchial and anterior lymph nodule will be enlarged definitely. Silicotic nodule is the pathogenic hallmark of the silica. Just now we say it to differentiate it from the other. There is it is in the upper zone, definitely, and then it will be continue to enlarge. It will affect all the lung, and these nodule will be united together, and then they at the end they will cause PMF, which is progressive massive fibrosis. Lesion will appear. Okay. These progressive massive fibrosis, the center of this fibrosis, there is a cavitation. So when we see this cavitation could be either due to the fibrosis or due to the TB, because just now we said they are more liable to TB. So either to ischemic necrosis or to the TB. Of course, the diagnosis from the history, chest X-ray, as we see, and then pulmonary function test, and we will see we have to exclude miliary TB, and then we will do differential diagnosis later on. And also, we will do general lung function test. Okay. Let us, okay. At the beginning, as we said, there is no change or little change in the function of the lung, but later on there is obstructed lung changes. Simple silicosis, as we said, it is there is a risk of development or to be complicated. And it's also associated with the other complication. What are these complications? Cardiorespiratory complication, progressive massive fibrosis, one of them. About a threefold risk of pulmonary and extrapulmonary TB will be liable, 3 times more liable. So complication for the lung and for the heart. Cold pulmonary will affect basal emphysema. Okay. Of course, this is death, of course, will occur later on as a result of the fibrosis. Immunomedical complication like disseminated sclerosis, sclerodermia, and rheumatoid arthritis are a complication of this disease. Also, in addition to the immuno and lung and heart, there's renal complication occurs. In addition, and we have cancer. occurrence of cancer by crystalline silica. This is regarding the first one, the classic one. Now coming to the accelerated, we said also it is two types, simple and complicated, similar, but how it occurs, accelerated, result from exposure, higher concentration. That one, low concentration, less than 30%. Here, higher concentration, and the time period is 5 to 10, while that one is up to 20 or even more. Due to the high exposure of fine dust, very fine, we said from 0.3 to 5, of high silica, of course. Clinical autoimmune connective tissue disease will occur, frequently associated, just like that, scleroderma, rheumatoid arthritis, and so on. Condition is progressive, just like that, even if we remove the patient from the exposure or prevent the exposure. Now, coming to the acute, from its name, acute silicosis or silicoproteinosis, it's the result from overwhelming excessive concentration, very heavy exposure to fine dust for months. It occurs within months. Even death will occur, may occur within months. So it is exposure to high concentration and very fine dust. Okay, it shows symptom within week to month, and 80% of the cases occur as little as a few years. Within a few years, 80% or even 1 year, and end in death within several years. So it's very, very acute case. Of course, death occur as a respiratory failure. In this cases, there is fever, weight loss, cough, dyspnea, and so on. It's frequently occur. This is occur where? In an area where there is fractures or crushing of the sand, because it is so small. They will, and the concentration is very high. That's why it occurs here. Crushed silica thus cause oxidate, lung injury, and more cytotoxic produce lipid peroxidation and induce more silica to the lung. Of course, clinical feature, chronic irritant, cough, we will have. Okay. Dyspnea within a short period, shortness of breath, worsen, fatigue, loss of appetite, fever already, chest pain, and so on. With the more advanced disease, impairment of the total lung capacity will occur. As we mentioned just a few minutes, with the acute silicosis, there may be fever, loss of weight, and so many other symptoms. Chest X-ray, the diagnosis is snowstorm, don't forget. And this snowstorm, it is in the upper part of the lung. In addition, there is this, of course, the silicotic nodule. There is eggshell calcification. And also, microscopically, there may be crystalline of, showing crystalline of silica. We said silica, in silicosis, there is liability of TB, or TB cases are more liable for silica. So we call it silica tuberculosis. Silica tuberculosis is a progressive, and what's more important is that silicotic are prone to pulmonary TB. We say we call it silica tuberculosis. Pulmonary TB occurs in about 25% of the patient with the silica, with the classic silica, acute or classic. The sputum, in this case, contain no TB bacilli. There is absence of TB bacilli. Now coming to the treatment, there is of course no specific treatment effective already. There is no treatment. It's only prevention. From the beginning, we said that occupational disease is mostly preventive disease. So there is no specific effective treatment for silicosis, definitely you know. Particularly fibrotic changes occur, cannot be resolved or reset again. Okay, there is no known method of intervention. The only thing is to prevent, okay? To prevent the condition to progress, the only way to prevent the condition to be progress more and more. But even that, we said, even when we will remove the patient from exposure, the progression will continue, but we will try to stop it at its stage. So what we are going to do is, rigorous dust control measure we have to do. You remember, we can use substitution, use another substances, okay? Enclosure, you remember, this is engineering. You remember prevention. The first line in prevention of occupational disease is engineering. So this is one of the methods of engineering that we do complete enclosure or isolation is also engineering. Don't forget. So, good housekeeping and personal protection measures. Of course, regular physical examination, you remember periodic medical examination, and we say the periodic medical examination, usually they do it twice a year, every 6 generally, but it depends on the condition, it depends on the material that we use. It maybe every week. Of course, there is no every week, maybe every month. So regular physical examination of the worker, periodic we call it. Oh, so silica exposure has to be stopped to prevent further damage of the lung. Smoking should be quit because it accelerated the occurrence of silicosis. TB positive patient should be treated. So all these, the course of progression is often extended over decades and even after cessation of the exposure. So prevention remains the most effective therapeutic approach to prevent silicosis, and this is almost, we say it at the beginning of occupational disease. Now coming to the asbestosis. This is asbestosis. Look at texture of the lung. Okay. Asbestosis is diffuse internal interstitial pulmonary fibrosis. This is the first difference from that of silicosis. That one is not related, this interstitial, diffused. So, fibrosis that occurs secondary, of course, to inhalation of asbestos. Asbestos is a commercial name given to certain type of fibrous material. They are silicate of varying composition. This silicate, when combined with the magnesium, iron, calcium, then it will cause the asbestosis. We call it magnesium silicate. So, what's the characteristic of asbestos? Previously, they used it a lot, but now, yes, still they use it. First of all, it is resistance to the heat, thermal resistance. It is resistant to that. That's why they use it in the building previously. And it is water resistance as well as chemical resistance. That's why. And more, it is flexible and high tensile strength. That's why they use it. That's so funny. Okay. Asbestos fiber are usually from 20 to 50 to 500 micron in length, and diameter is 0.5 to 50 micron in diameter. Depending on its characteristic, just I mentioned it to you. So they use it when they use it. Fireproof textile, because it is resistant to the thermal. It's used in wire insulation. It's used in friction material, break-in, and roof and floor product. Okay. And ship construction, because textile. That's why this is okay. They use it also as asbestos. Asbestos is classified into two groups: serpentine and amphibole. 93% of the commercial they use, okay, serpentine. Only 7% were used the amphibole. Serpentine, they call it also a white asbestos. Regarding amphibole, there is either brown or there is a blue asbestos. You can see this picture. Serpentine, amphibole, only 7%. Look, كل المحاضرة picture أصلا. Type of exposure here, either directly or indirectly. How it occurs indirectly, let us see. Okay. Directly could be either preliminary in the mines and mills, secondary manufacturing plant, directly رأسا من mines. Indirectly, by standard exposure, okay, or by household. أنا أشتغل معمل أروح للبيت I have other member. This is indirectly. أو أنا رايحة لأحد المعامل, so indirectly I'm not working over there. So who are at risk? All these are at risk. Plumber مين دا يحكي رجاء. Okay. Installation worker, carpenter, and welder, all these. The miners and millers, okay. Of course, the prevalence is increased with the length of employment, definitely, those response. And also the prevalence increase with the smoker and ex-smoker. They are at risk. They are at risk and at a high mortality rate. So, asbestos enters the body definitely by inhalation as a fine dust and deposit in the lung, in the alveoli. It is insoluble from the beginning. We said it's insoluble because irritating of the lung tissue and then pulmonary fibrosis, just like the others. That's why. Then it leads to the respiratory insufficiency and death. Carcinoma of the bronchus occur. And the risk of bronchial carcinoma is reported to be high if exposure, occupational exposure combined with the TB. Combined with the smoking, cigarette smoking. Okay. Actually, in UK, they did a study. They found that there is a patient. They are not working in the factory, but they are living almost 1 kilometer away from the factory in which they use asbestos. And they get the carcinoma, okay, mesothelioma. So Mesothelioma is a rare form of cancer, okay, of the pleural and peritoneum. It is strongly associated with the crocodile blue asbestos. You remember we divided into two parts, blue. Okay. The disease does not usually appear until 5 to 10 years exposure. Cancer also of gastrointestinal tract will occur as in the asbestos exposure. Okay, definitely, because it is inorganic and it is insoluble. The fibrosis, as we mentioned, occur as irritation as a result of mechanical irritation, and then fibrosis occurs. Prebronchial diffused is diffused and basal location of these fibrosis. So this is the differentiation between asbestos and silicosis. This is basal, that one upper. That one nodulated, this one is diffuse. This is very important. In contrast to the silicosis, already we mentioned, it is on the upper and it is nodulated. The lung architecture will be changed, of course, with the time, just you see it, okay? And of course, there is obstruction of the airway and death will occur. This is occur in latency period 20 to 30 years of exposure. Clinically, the disease characterized dyspnea, cough, chest pain, bilateral, respiratory crepitation, posterior and basal. In advanced cases, there may be clubbing of finger. So clubbing of the finger is one of the diagnostic signs. Okay. Okay, thank you. Cardiac distress, cyanosis, and so. And also, the important asbestos fiber could be seen in the sputum. Okay, خلينا نشوف what can we do. Okay, lung function test will affect it. X-ray we already see. We already mentioned that diffuse nodule as it is in the base. And also shaggy heart sign. There is an interstitial fibrosis. They call it shaggy heart sign. This is the interstitial. Histologically, as we mentioned, there is, okay, this is the fiber. When we, okay, no need. Please come below. I am sorry. Because I don't know. أي سؤال؟ ما بس. لا أبغى حق. في ألم جايين بلا ألم. أنا معي ألم. خذي.